Hello, and welcome to On Purpose. Today, I'm joined by Dr. Angela Shippy, who is the Senior Physician Executive at Amazon Web Services, or AWS. Welcome.
Thank you so much for having me. It's great to be here, Kristen.
So, I know that all the people watching today are going to be so inspired by all you have accomplished, but what I wanted to start at is what inspired you to actually be a physician, which was the beginning of this journey?
So I'll tell you, I decided that I wanted to be a physician when I was 9 years old. And part of it was because a teacher told me that I was really smart. And so 9-year-old me thought, well, if you're really smart, you should be a doctor. And if you're going to be a doctor, then you should be a neurosurgeon, because of course the brain is the most difficult and complex part of a person. And then over time, what I found is that my natural curiosity as an only child and the immense connection that I felt with people, that I not only wanted to be a physician who could help others, but I also wanted to be a physician who took care of lots of people in lots of different ways. So ultimately, I decided I wanted to be an internist.
So, you have impacted many people in so many different ways, but from what I've read, one of your first roles as a physician, you were managing up to 25 patients a day, which just seems like mathematically impossible to me. What was that like, and how did that make you feel?
I mean, I'll tell you, there is no greater joy than laying hands on a patient. There's nothing better than being able to have a conversation with the patient and their family and talk about what's happening with them, what disease process have they just been diagnosed with, how can you make them better? And especially as a hospitalist, because I was taking care of people during moments of crisis,
Right.
right? It was an acute myocardial infarction or a heart attack, it was a stroke or something like that. And so that ability to be able to really do that, and then to allow them to see, like, yes, you can get better, and there's a treatment plan for you, and we're going to work through it together. That's one of the things that I always really loved about taking care of patients directly.
So, did it ever become like overwhelming after a while, seeing 25 patients a day?
Never overwhelming, but one of the things I noticed is sometimes it could be hard to navigate the healthcare system. It was really a complex system. And sometimes that would be hard for not only the patients, but also for my colleagues. And so I said, I want to make this better. I know there's a lot that happens behind the scenes, but I don't want that to impact the patient. And I don't want that to impact their family and how they get from one place to another. And that's when I started to think, how can I make healthcare better? How can I work at scale and help more than 25 patients every day? And that's when I started taking on some administrative roles and doing things a little differently.
So that seems like a pretty big transition. Talk to me about some of the pain points that inspired you most to try to change.
So I would be taking care of a patient. It's time for discharge. I'd spend 45 minutes at the last day going over all of the paperwork with the patient, talking about what medications they were going to be on, what was the next visit they were going to have, and follow up. And then 2 days later, I might see that patient come back to the hospital because something about that discharge didn't work for them or was broken. And I said, I don't want that to happen to patients. I want it to be really clear what's needed for them at discharge, what the expectations are once they get home so they can continue to take care of themselves. And that was one of the key pain points I saw early on. How can we make the discharge process better for patients?
So, your desire to have impact in healthcare at scale brought you into technology. You seem like a very technology savvy person. Was that from the beginning? Have you always had a passion for technology? Or how did you say move from I'm going to impact patients in healthcare and technology is going to be the way I do it?
Well, I'll tell you what's interesting is my entire career, I've been an end user of technology, starting with when I was a resident, starting my internship. We had to come a couple of days early and learn how to use computer physician order entry, or CPOE. That was in the very,
Wow.
very early days. We were mandated to use it. And so my entire career, it's been like that. It's been some type of technology, whether it was the Palm Pilot for documentation, whether it was medication reconciliation records. I've always been involved in either being a physician champion for technology, using it, trying to make it better and easier for my patients. And certainly having a printed medication list was very helpful as opposed to one that was written out by hand.
So, Angela, as the senior physician executive at AWS, you have a bird's eye view to some of the biggest healthcare advancements in technology that are out there today. What do you think are the technologies that are going to have the biggest impact on healthcare over the next, say, 5 years?
So there's a couple of really interesting things that are happening right now. So health systems and their healthcare leaders are really thinking about their operational efficiency. They're thinking about their workforce, how to make it more seamless for them to do their work, and how do they make better experiences for patients. And they're utilizing technology to do all of that. So, for instance, for operational efficiency, how can they help to overall decrease cost, understand where they are from a staffing standpoint? What is it they need in terms of supply? So they're taking all the data inputs that they have from the electronic health record, from their enterprise systems, and they're putting it together. And that data is helping them have predictive analytics that are telling them what do we need in terms of supplies, what's the staffing ratio that we need during times of high peak patient volume, and they're utilizing that to become more efficient. As it relates to workflows, they're utilizing technology right now to make it easier for clinicians, for that entire clinical team to do their job a little bit easier. And in doing that, allowing them to work at the top of their license, which we know is so incredibly important for the resilience of the work that they do. So now, instead of having to click through medical records and look at a patient's history, they're able to utilize some generative AI tools to summarize the patient's clinical history. So that's right there and available. That way, the interaction is more eye to eye instead of looking down and looking up. And that's very meaningful, not only to the clinician, but to the patient. And then other ways that they're helping to improve that patient experience and patient engagement is patients are looking for information across a continuum. It might be that they're acutely ill and they're coming in, or they're coming for a follow-up visit, or maybe they just need some information. Being able to have tools that allow that patient, when they come to access a health system, their hospital, their physician, they're able to have a personalized experience, interacting with chatbots and technology that's allowing them to get the answers they need when they need them, and access to care no matter where they are, allowing for those more virtual visits.
So that's super inspiring. And sometimes you interact with the healthcare system, and that might be your experience. But I would be venture that most people listening say that sounds like a great healthcare system, but I haven't seen it yet. So that tells me there are challenges in getting to the vision that you outline. What are some of those challenges, and what can we do to try to get to your destination sooner?
Well, I have the opportunity to talk to hundreds of customers across the US every day, these healthcare providers who are working towards it every day. So not only are they engaging in technology, but they're still doing the work that they've had to do every day. So it's going to take some time, and they're taking stepwise interventions to make that happen. One of the things I love about the generative AI services we're building at AWS is that we're taking into account that it's important to be free of bias and that you're delivering equitable care. So we're allowing them to have guardrails that are built into those services. So as they're building these applications, it's readily available. And not only that, we know it's incredibly important to health systems as they're building towards this future of what healthcare delivery is going to be like, that they're taking into account the security of the information that they have regarding patients. And so ensuring that it's a top priority for AWS as we build these services is allowing them to build applications again that are taking security to heart.
So, as a tech savvy early adopter, you've been talking about Gen AI. What are you using Gen AI personally for? How is it making a difference in your life?
So for me, I've been using generative AI quite a bit to help me with. Recently, I did some deliveries of some special gifts to some really good friends of mine. So I actually used generative AI to tell me the best route to go from house to house, which was amazing. So it gave me the best route with the fewest backtracking of turns to get from place to place. And if you know anything about Houston, you know that things can seem really close, but depending on the time of day, it can take a little bit longer. So that was one way I've used it recently. And another way that I'm using it like all the time is I love using generative AI to help me start emails, start documents and paragraphs and things that I might need. I think for many of us, we've got great ideas and we want to put them down on paper. And sometimes we're agonizing over the right word and we're looking at the thesaurus and all of that. I love using generative AI to help me get started and to help me move a little bit faster as I'm putting documents, sentences, words together.
So if you combine sort of what you're working on now that you've shared, and where Gen AI is going, if you could leap forward 5 years, what do you think healthcare will look like in 5 years? What would be the big changes to someone who's experiencing it today to what it's going to look like 5 years from now?
The biggest change is going to be we're going to get to that point as I have my healthcare hat on and I think about the years of taking care of patients to where we have the access that we need for patients. So no matter where they are, no matter what their question is, they're going to be able to get the answer they need. Sometimes they just need a little bit of help and a little bit of information, as I talked about earlier. And sometimes they need a lot more information, like if they just had a new diagnosis. The ability to be able to have those tools right at their fingertips, right with their smartphone, being able to interact with a clinician, with information from a specialty society, with their health system where they're already established, being able to have those personalized interactions so that they can also be part of taking care of themselves outside of the four walls of a clinic or a hospital is going to be really important. And it's probably the one area in healthcare we haven't activated enough is the patient. And now that we have tools to really increase access, I think that's going to be where healthcare is in 5 years. Easy access for patients right at their fingertips, helping them to have the best possible care and the best possible health outcomes.
So one of the things I love about you is your infectious passion. You seem incredibly purpose driven. So if you were to sort of define your own personal purpose, what would that be as you look back on your career?
Sure. I mean, one of the things that I've always loved about being part of a healthcare environment is the way we work in teams and the way we help each other and the way really, we really need everybody's expertise around the table or around the patient, if you will. And so that's one of the things that I've always really loved is being able to work on a team, being able to inspire those teams. Um, when you're working together, sometimes it's not always easy when you're taking care of a patient. Sometimes it's not always easy when you're in an administrative role. So being able to work together, be completely transparent in what's happening, and really share the good and the bad times. I mean, that's what always has connected me to the work that I do. That's what really drives me. And what gives me a lot of joy is knowing that over the years, medical students, interns, residents that I've had, people that have been members of my team, even outside of training, when they go on to do something else in another organization, they're taking those learnings with them. So again, it's another opportunity to scale. And I've really always enjoyed being able to see people thrive in what they do.
So living your purpose and having your passion can also have you traveling the world, seeing customers. How do you manage your own energy and recharge yourself with all that? I mean, it sounds great, but I got to imagine at some point it can be a little draining. So, what do you do to stay energized and to recharge?
There's nothing that brings me more joy than talking about how do we reimagine how healthcare is delivered. That energizes me all day long. So being in front of people, having that conversation, deciding how we're going to make it better for the next generation of clinicians, for the next generation of our patients, that really energizes me no matter what. And I've also been thinking a lot lately. My daughter's interested in going into medicine. And I think to myself, I don't want her to be having the same conversations that we have right now. So the time is now to really fix what we think is broken, change the complexity so it's easier for patients to have access, and really improve the health outcomes for the communities that we all serve.
So, you are a role model to so many healthcare professionals across the US and undoubtedly across the globe. What was some of the best advice you received that sort of helped you achieve where you are today?
Some of the best advice I ever received. I had someone who was a great mentor to me, who said, one, you need to be true to yourself, connect to your purpose, uh, know that you need others on your team. Like I said, teamwork so incredibly important. Uh, Remember the good times. Remember the things that have really that you've done well or your team has done well because that'll help you get through. And also to always lead from a place of authenticity, like who you are, what your purpose is, what you believe in, and that's how you can inspire others to want to do the same.
Yeah. So as you think about your daughter and the next generation who's coming into healthcare, what advice would you give them? You painted a picture of what healthcare could look like in 5 years. And as you prepare your daughter and the next generation of healthcare leaders, what advice would you give them?
Well, one of the things I would say is know that throughout your career, there will be ebbs and flows. That's okay. You're going to learn from every experience. Uh, when you do something, it doesn't work. Be be willing to fail fast, learn from it, and move on. Move to the next thing. Sometimes things won't go your way. That's okay, but don't harp on it. Really remember to celebrate those moments that did work well. And the other thing is to be in a place of gratitude. Uh, I know that I I really enjoy the fact that I can help somebody else. I have been energized not only by those conversations and being able to help them, but the fact that when I hear back from them about the impact that that's made on them, um, that really helps me keep going when it's really tough out there. I have a book of thank you notes that I've received over the years from colleagues, from patients, from mentees, and every once in a while, I'll go back and look at that. And I just love seeing that the work really does make a difference. And it really propels me to continue on.
Well, you have been an incredible positive disruptor for healthcare, an inspiration to so many people, and I love your focus on gratitude. And it's a great close. So thank you for joining me, Dr. Shippy, and thank you for joining us for this episode of On Purpose. I look forward to seeing you again next time.